Hi, friends. I am so excited to talk to you about the International Coaching Federation and how they have made this week International Coaching Week. So, what that means is they are encouraging coaches such as myself to talk to the public and create events to educate them on what coaching is and how it can potentially benefit them. So, I want to use this time to do just that and talk to you about a lot of the common questions that I get as a coach. And the very top one would be, well, what is a coach? Coaching to me is a very individualized and unique service provided to someone who is perfectly capable, and they're usually an ambitious achiever. And for whatever reason, there may be some kind of block, or they find themselves running in circle about certain things that they'd like to change in their life. But that could also be something professionally. So if they're wanting to transition into a different job or maybe a higher position or reach sales goals. And then it could also get very personal, such as help being helped around procrastination or reducing judgment and jealousy or becoming more aware or aligned with who they really are. Um, so that would be what a coach is, and I guess what I would like to add to that is like a coach will talk to the client and they will figure out clarity around whatever goal that they have. They'll create actionable steps together, and then the coach will hold the individual accountable to reach those goals that the client has set forth. So then let's come to a therapist. Well, what is a therapist? A therapist is someone who has been clinically trained in mental health. And I guess when a client goes to a therapist, a lot of times there may be a focus on some history or previous events that have occurred with the client, and the client's finding it difficult to move forward and past what has happened to them previously, and that's affecting their behaviors and their thought processes. And a therapist will provide a treatment plan for that client, and typically it does result in some kind of impression or diagnosis of a mental health condition. So a coach is not a mental health professional. They're two totally different things. However, they're also similar. Because a coach can help move forward, if there's an individual who's kind of resonating a little bit. But it's possible that a coach could refer a client to a therapist if they feel like it's out of their expertise and experience. That's very possible for someone to have both experiences of a therapist and coach. So the biggest differences, I would say, would be that a therapist again creates that treatment plan and ultimately has some form of impression or diagnosis for a mental health condition, and then a coach co-creates whatever outcome it is that client wants with the client, and holds the client responsible for that through helping them figure out actionable steps and holding them accountable. So I love it because it's more of a relationship, and knowing that the client is a whole person and they're perfectly capable of following through with things. It's just that they might be having some sort of block. I guess if you have any other questions, feel free to ask it below in the comments and I'll be sure to respond back. If you would rather keep it private, you can private message me on Facebook and I'd be happy to respond. If you're interested in getting coached, then you can go to a Facebook search and look me up at Dr. Teresa Green, and I have a coaching request form. It's a Google form, and that's in my bio. Or you could also click on the Book Now button and then click on the one-on-one session, and we can have a conversation around any questions that you have, what the coaching process looks like, and if you have any interest in being coached and how I could help in any way. So I wish you clarity and love and light this week, and I hope that you choose to experience coaching.